Hi everybody, welcome to Health Coach Sunny. Today I have a special guest. Her name is Gina Larobina, and she is an internationally certified lactation consultant. I'm so sorry.
That's okay.
It's too
It's
long.
a lot of words.
Yeah, it's IBCLC.
Yes.
And Miss Gina has been with the JPS for 7.5 years. Before that, she worked for WIC for 11 years. And thank you for helping with that. Miss Gina obtained her IBCLC, International Board Certified Lactation Consultant. I got this right this time. Firstly in 2011, and she was recertified in 2021.
Yes.
That's every 10 years you needed to take the exam again. So I'm really so happy and excited to have you here today because babies and we see babies and we have so many questions from mommies and we need your help. So can you briefly tell us what is IBCLC?
Sure. So the IBCLC is an International Board Certified Lactation Consultant credentialing. So I can practice lactation essentially anywhere in the world, globally. And it is a rigorous exam that's given twice a year. You have to have education hours in lactation. You have to have some college coursework, and you have to have clinical practice hours before you can sit for the exam. Typically, it can take a candidate anywhere from 1 to 5 years before they sit for the exam. And the exam will cover breast anatomy, infant anatomy, and then, of course, lactation issues for mom and baby.
Good. Thank you for explaining, because a lot of us don't know that. That's very helpful. So should we move on to the most common questions?
Yes.
Okay, so this video we're only going to talk about the babies during their first 2 weeks of life. So first question. Mommies always say, my milk does not satisfy my baby. I don't have enough breast milk.
Yes, most moms believe that they're not producing enough milk, especially in the first 72 hours or 3 days after they deliver. From the time we get pregnant, our breast will begin making glandular tissue or milk-making tissue to feed our baby. So during our pregnancy, with each pregnancy we have, there's more glandular tissue available. So you have the potential to make more milk with each baby you have. It's less than 5% of women in the world that don't produce milk or can't produce milk for those babies. And typically those moms have really small breasts or are flat-chested, or breasts didn't grow during puberty. Or there's a medical history. Mom may have a medical history that will prevent her from producing milk for her baby. So when we get pregnant, our breasts start making colostrum about our 14th to 26th week of pregnancy. So we start preparing food for our babies very early in pregnancy in case we have a preterm birth. If we deliver at 23 weeks, 25 weeks, or 26 weeks, we will have, there's colostrum, and that colostrum is specific for a preterm baby. It knows my baby was delivered early. So this food is specific for that baby. But when our babies are born, their belly is very tiny. It's about the size of a marble, and they're only eating about 5 to 10 ml of food each feeding.
Less than a tablespoon.
Less than a tablespoon. So sometimes I tell my moms, if I gave you 5 ml, will you wait 2 or 3 hours to eat again?
No, maybe a 15 minutes
Thank
later.
you. Yes, so 15 minutes. So that's what begins to happen. Breast milk is easily and quickly digested. It's a live and living substance. So the minute it hits the belly and it touches the skin of the digestive system, the body's absorbing it. So a baby that's exclusively breastfeeding will eat frequently. So moms begin to get concerned because my baby's asking to eat frequently. By day 3, the baby's belly is going to grow significantly. Now it's about the size of a ping pong ball, and your baby is going to start consuming about an ounce of food.
30 cc.
30, yeah, this says 25. So anywhere from 25 to 30. Typically, we see babies consuming 30 when they're breastfeeding or more, depending on how much milk mom produces. So again, if they're eating an ounce, will they wait 2 or 3 hours?
Probably
Not. Typically, we see exclusively breastfeeding babies eating about every hour and a half coming into day 3. Okay?
Okay.
And then by the time they're 7 days old, now the belly's much bigger. It's about the size of a plastic Easter egg. And they're consuming it, this is day 7, and they're consuming about 2 ounces or 60 ml. This is 51. So 50 to 60 ml. Or
so their little belly really grows fast.
it grows very quickly.
This is just sum it up. This is 1 day,
Day 1.
day 3,
Yes.
and day 7.
Yes. So
That
that's
is
so sometimes what we see,
amazing.
what happens is if moms don't think they're producing enough, right? I don't feel like I have enough milk, and my baby's asking to eat frequently. In the hospital, we're going to give you a 2-ounce bottle to supplement your baby with formula if you're asking for a supplement. And so we shove this volume into this little belly.
Then they spit up.
They spit up. They're
not
crying.
comfortable. Yeah.
They have a belly ache. You know, so sometimes we can complicate feeding. But here's another visual, if you want to see it this way, that I like too, because it shows the milk volume and what they're eating. So day 1 is about the size of a cherry.
I will always remember that.
Yeah,
I love
it's super
cherry.
small. And they're eating small volume, 5 to 7 ml. That's what the colostrum volume is that the breast produces. Day 3, about the size of an apricot, and they're eating about an ounce. And then day 7, they're consuming about 2 ounces.
Okay, that's very good, very good. Okay, should we move on to the next one?
Yes, ma'am.
Okay, well, Gina, tell us more about the weight gain and the weight loss in the first 2 weeks.
Sure. So our babies typically will lose weight within the first 5 days. It's normal for our babies to lose up to 10% of birth weight. Depending on how you delivered your baby, C-section or vaginally, intervention, you know, if you had pain management, epidural, if you had IV fluid, all those things too can impact weight loss in the first 24 hours. So typically we'll see babies lose weight, and then by day 5 they start trending up, and after day 5 we want to see babies are gaining 3 to 8 ounces a week.
Okay, that's good. Thank you. So by 2 weeks, usually we expect the babies to gain their birth weight back. Okay, that's pretty sufficient.
Yeah. So if a baby's not back to birth weight by 2 weeks, sometimes I'll work with the provider and we'll bring them back for a weight check, and we typically see by the time they're 21 days old they're back to birth weight.
Yeah, we'll just monitor weight more closely. Okay. Next question. My baby does not sleep at night. This is the most frequent question being asked from my patients.
Yes, it is. So baby that's exclusively breastfeeding, again, is eating every 1 to 3 hours. And the hormones that our breast produces to make milk, the hormone prolactin specifically, the level of prolactin is very high in the nighttime, overnight hours, early morning hours. So there's more milk available. It's like this oozy buffet, all-night buffet. And moms just pass babies back and forth.
That's
from one
even
breast.
when the baby was in mommy's womb. So they got used to just eating more at night.
Eating more, right? When mommies are pregnant, especially a working mom, and she's busy during the day, sometimes babies are a little quieter. They're a little more tense. The belly's a little firm. But the minute she goes home to lay down at night, babies start moving. They're more active because there's more blood flow, right, at night to the placenta. So they're used to being up at night. But that will change as your baby grows over these first 3 months. They will have significant feeding changes, feeding pattern changes, and sleep pattern changes.
So as Gina said, this may take up to 3 months for the baby to get the circadian rhythm like adults.
Yes.
So sometimes I tell mommy and dad because they're exhausted. So maybe after lunch, you keep your baby awake for a little bit longer period of time. So when it's getting close to dinner, maybe the baby can go to bed and sleep a little longer. So if you let the baby just sleep all day, they're going to be up all night. So you slowly train and slowly increase that period of time in the afternoon to keep them more awake.
Yeah, we will suggest that to moms as well. You can try nursing more frequently during the day. You can wake your baby to feed your baby more frequently during the day to see if they can transition their long sleep patterns from day to night.
Yeah, so I'm gonna have to wake up that baby frequently, poke you, wake up, wake up.
Yes.
Just nurse during the day more frequently. Okay. The next question, my baby has diarrhea. The poo-poo is watery and poops a lot.
Yes. So our breast milk acts as a natural laxative for our babies. So by day 3, your baby should be pooping minimum 3 times, but typically for an exclusively breastfeeding baby, we can see a baby will poop up to 12 times. Poop is really soft, it's watery, it's seedy. It can have a color of mustardy yellow to green, brownish, and that's all normal poop.
But in the very beginning, the poop is very sticky, dark, black, and then move on to green.
So typically by day 3, it's like a dark green, might be a little looser, it's not as pasty. By day 4, it's really green. It's getting looser. By day 5, we like to see poop is yellow or mustardy looking.
You know, Gina, I appreciate you this very much because I forgot that actually breast milk can act as a natural laxative.
So sometimes babies that are jaundiced and we're concerned about Billy, especially if they're exclusively breastfeeding, you want to assess the feeding. Is this baby able to transfer or move milk from the breast effectively, right? So we look at weight loss.
Yes.
And then jaundice or their Billy level. And then if she's needing to supplement, we recommend supplementing with her own breast milk because baby will begin stooling frequently.
Yes, okay. That's probably why I have this question from other babies who are formula fed. It's always, my baby does not poo-poo.
Yes.
3 days having poo-poo.
Yes.
And then we have to, that's another topic for the future. So number 5, my baby is hungry all the time and my breasts don't feel hard anymore.
So we typically see that about 2 weeks. Our babies will go through several growth spurts in the first 6 weeks of life. We generally see at day 7, babies get hungry, and then again at 2 weeks, 4 weeks, and 6 weeks. During that growth spurt time, a baby can grow a ½ an inch in 24 hours. So they need the calories, they need the food to do this rapid growth. So they'll feed frequently every 30 minutes, sometimes every 45 minutes. And then the hormones that our breast is producing to drive our milk supply or production in the first 2 weeks, that hormone level comes down. It's now more regulated. The breast is responding to your baby's feeding frequency. And now the breasts don't feel full anymore. They're not leaking as much. They're not as heavy.
Got it. Okay, let's move on to the next one. What can I eat or drink to make more milk?
Nothing. That's controversial though, right?
Yeah, the reality actually, if you drink more liquid, like soups, I always recommend the soups, homemade soups, not the cans, not from those bottles that you get over the shelf. So you make chicken rice soup, you make beef soup, vegetable soup, whatever, the protein vegetable soup.
So you don't want to get dehydrated. So typically I tell moms to nurse on demand as much as your baby wants as often. Be sure you're eating well, be sure you're drinking plenty of water. Continue taking your prenatal vitamin or a vitamin while you're breastfeeding.
Yeah, we don't want to produce milk to feed another human being to grow so fast, and then we are so deficient and depleted of nutrients.
And we do see that. Sometimes
we have a hair loss and they grow gray hair. Oh my goodness.
Yes, I've seen women lose teeth.
So mommies, we want you to take care of you as well.
Yes.
So pay attention to your diet.
Yes.
Okay.
Eat well.
So next one, which is the last one for today, the last one. What am I not supposed to eat when breastfeeding?
Nothing. Eat whatever you want.
I would say no fast food, no processed food, because that's what I'm against for everybody.
However, if you have a mom that's her regular diet, and then all of a sudden you change her to like a totally different diet, her baby may then have an issue with this diet has changed. I don't know what this food is.
So in that sense, then I strongly believe mom's diet is very closely correlated with the baby's health.
Yes. So sometimes we see that, right? Moms who have a high dairy diet or do a lot of processed foods, babies can develop like eczema or some flaky skin in the brow.
And sometimes I see the little cheeks all excoriated. And poor thing, the mommy's daddies, they put the gloves on baby's hands so they don't scratch. I feel so sorry.
Yes. So when in those cases, we recommend if she's going to make a dietary change, she eliminate dairy first.
Exactly.
And see if there's a change.
Exactly. Yeah. So I have, personally witnessed all these positive results from just to simply change one thing.
It's amazing.
Remove one thing from the diet.
And then culturally, right? Because we work with a lot of cultures.
Yes.
Culturally,
absolutely.
most cultures believe if you want to eat something in like a fenugreek, an herb fenugreek, or anise, they like the herb anise. They're either adding it to their food or they're making a tea with it.
Yeah. So this kind of go back to question number 6. Actually, the fenugreek, you can buy the supplements from any, even grocery store.
Yeah. I would just look, make sure it's a good quality.
Exactly.
Fenugreek.
All the supplements is as best as how they make it.
Yes.
Yeah. And prenatal vitamins as well. Please don't choose the, cheap one thing. There are some people tell me that I buy vitamins in dollar store. I was like, oh my gosh.
I just saw a little report that said Dollar General over-the-counter Dollar General medication.
Yeah, they sell a lot.
It's bad. There's a risk. So I have to read. I have to finish reading that.
So there's a lot of going into what vitamins to choose as well. So I would just buy a good source. Yeah. Like a good brand. Like if you don't want the fancy ones, the more expensive ones, choose something like a Nature Made.
Nature Made, yeah. And then I think Sun Valley.
Yes. Has Country Life. There's a Country Life as well. It's very good. Yeah. Okay. Well, Gina, thank you so much.
Thanks for having me, Sunny. This was fun.
I learned so much from this little session today, and I'm so excited for more to come.
Yes.
So, everybody, thank you for watching today. Please come back and visit us again. We'll have more videos like this coming up soon. Bye-bye for now. Bye. Thank you, Gina.
Thank you.